Hello, this is Janelle Tipton from Purdue University. I'm presenting a poster today entitled Focusing on the Facilitator to Improve Palliative and Hospice Care Competence Through Simulation. I'd like to also acknowledge my co-author, Amy Nagel, who is our Director of Simulation at Purdue, who collaborated with me for this project. So as far as our background goes on this topic, we instituted a palliative care, hospice, and end-of-life simulation in the undergraduate public health nursing course in 2022. As we have observed how things have gone over the past few years, we noted that many times only half of the public health faculty had training and facilitating simulation. And so they were very naive and unclear of some of the best practices related to simulation. This inconsistent facilitation impacted the simulation's effectiveness, as evidenced by the DASH debriefing scores, as well as other evaluations by the students. And based on this information, we decided to target faculty development to improve simulation and to help the quality and student outcomes that we hope to achieve from the simulation. The methods for this project include the development of an educational course, which will be conducted by the Director of Simulation and certified facilitators at Purdue. We are planning to provide this education in August of this year, and the goals of the program include to equip the faculty with evidence-based guidelines for simulation practice, to promote consistent delivery of methods for simulation, and to improve the hospice and end-of-life care simulation learning experience for the students who will be receiving this during their course. The educational content will include standardized pre-briefing scripts. These will be provided for the 3 different vignettes that we have for the simulation. There will be in-depth debriefing guides for the faculty to be able to facilitate the debriefing and provide the students with content and review and reflection. We'll also provide detailed scenario outlines with predetermined cues to guide students through the 3 scenarios. We really feel that this content is important for our curriculum based on the AACN Essentials, which were updated in 2021. Hospice and palliative care has been noted as a priority, and we feel that it is important to include not only in public health, but in other areas of the curriculum. But we are focusing on our simulation for this course because they do have clinical experiences in hospice. We also believe that by providing high quality end-of-life simulations, the students' understanding of this content is valuable, and they will be able to have practice prior to seeing real patients in the hospice care setting. Our students love simulation, so we think it's a very effective teaching tool that we can use for the course as a teaching method. Additionally, we want to provide other quality improvement efforts by reviewing the current sim scenarios, evaluating for content accuracy, and seeing if it's still current. And we'd also like to provide our faculty with resources related to LNEC. As we are embarking on providing the simulation, we want to make sure that the content and resources are available to our faculty, especially newer faculty who may be more unfamiliar with this information. We will evaluate this program and compare scores from our previous 2 semesters. We'll be looking at the DASH scores. We'll be looking at the SET-M scores, which looks at the simulation effectiveness tool. We'll be looking at the student pre- and post-test evaluations, which we'll be providing prior to and after the simulations. And we'll also be looking at public health exam scores as we provide exams throughout the semester, and we will have hospice and palliative care content on one of those. I do have references for this presentation, and they are available upon request. Thank you for listening to this presentation, and we are hopeful that this educational work will help improve our palliative care and hospice education for our students. Thank you.